Hello and welcome to our meeting of the Children and Young People Scrutiny Review Board. I'm Councillor Danielle Lind. Before I pass you over to Lindsay to do a roll call of who's online, I'd like to ask that if you are not speaking, please can you mute your microphones to avoid any interference. Okay, thank you. Can just hand over to you, Lindsay, to do a roll call who's here. Thank you.
Thanks. I just need to ask one question. I've got somebody on the phone with the phone number ending 4511. Could you let me know who that is, please? Could you identify?
Stephen Grundy.
Okay, thanks very much, Stephen. That's great. Okay, at the meeting tonight, we've got Councillor Lind, the Chair, Councillor Cuss, Vice Chair, Councillor Hesselgrave and Councillor Testro. Officers presenting Pauline Anderson, Sue Ann Lim and David Gardner. Myself, from Democratic Services, Lindsay Stevens, my two colleagues, Dominic Monaghan's on technical and Jackie Waring's on is muter and general assistance. We have co-opted members Tracy Churchill and Stephen Grundy and the Deputy Youth Mayor Priya Gill. And that's it, everybody that's here. Oh, Chris Hulse, I beg your pardon, Chris Hulse is also here. He's a co-opted member. So sorry. Do go ahead.
Thank you, Lindsay. So apologies now then. I've had apologies, Lindsay, from Councillor Patterson. Are there any more apologies?
I have none.
Okay, thank you, Lindsay. So item 2, there's no late items to be introduced. Declarations of interest? No declarations of interest expressed. So item 4 now, minutes of the last meeting. So can we all agree that the minutes of the last meeting are a true and accurate record?
Chair, I think
Yes.
Tracy Churchill was at the meeting, but I don't think she's down as somebody who was present. It may be that I've misread the minutes, but Tracy can confirm either way.
Right, okay. Can we just check on that, Lindsay?
Yeah, sure, yes.
Okay,
Tracy's
thank
here
you.
tonight. I'll check and I'll add her to if she was here.
Right, okay. So other than that, we're all happy it's true and accurate record then? Happy to pass them? Yeah?
Yes, Chair.
Yes, okay. Thank you very much. So moving on then now to item 5, which is CAMS and mental health for young people. It's an update from David Gardner, I believe. David, thank you.
Yes.
Evening, councillors. Today's report, we've given you quite a lengthy report, which I'm going to take as read, but we have some PowerPoint slides, if Lindsay could put them up for us, which I can take you through some of the key points, because I anticipate that you'll be wanting to ask some questions both about the report and some of the data we're going to show you in the PowerPoint slides. By way of context, councillors will recall that we had been here twice before, and we're talking about the waiting times for CAMS and what we're doing about access to children and young people for mental health services. And you'll know that we've had a strategy to increase that access from 25% right up to 36%, which is where it is now, over the course of this year, and we're intending to proceed to increase that still further over the next few years in line with the national strategy. And you'll recall that we talked to you about the targeted intervention services, which are services we've put in place before CAMS, so that schools and families can access those services where people needed therapies, which began to take some of the pressure off the CAMS team so that they can deliver more complex support. And you'd asked where we were with some of the waiting times for these new services, so we'll take you through that. We also anticipated talking to you about what's called the Future in Mind refresh, and the Future in Mind is the strategy for children and young people, mental health. In fact, NHS England have put that back until September of this year. There has been some welcome announcements about funding and resources, and that's partially why. So today we can't give you the full refresh. That's not been done, but it does give us an opportunity to give you some of the highlights of the key areas and an opportunity for you to comment on those priorities ahead of us completing the report in September. That report gets published on both the council websites and the CCG websites. That's a sort of an obligation on the system. So you take us to the next slide, please, Lindsay. So this is really just to tell you about what's happening to access. So these are appointments, and you'll see that really during the latter half, well, during the course of 2020-21, not surprisingly, the number of appointments have gone up considerably. 186% compared to the previous year, but that's largely because of the use of digital technology and seeing people over computer systems rather than face to face. So the unexpected positive of COVID, and I try to look for some of the good things, has been the fact that many people turns out to quite like using this system. And that has been the preferred choice for a number of people, but by no means all. And it's equally true to say that there are people who want to wait till they can see to people face to face. But you can see activity has gone up considerably for our CAMS provider. If you want to take us forward to the next slide, please, Lindsay. And in terms of demand patterns, you'll not at all be surprised that we follow a similar demand patterns that we've seen in other children's services, and that in some ways mirrors what's been happening to schools. So when we had the schools returning in September, we then had a rapid rise in referrals. This then began to drop again, and it's now beginning to rise again. And of course, we haven't got the February-March data to show you yet, but we'll anticipate that sort of flowing back up again. If you want to take us to the next slide, please. So waiting times therefore follow a pretty similar pattern, where we've had waiting times in the city and south for around 15 weeks, but that has risen throughout during the sort of like peak of the pandemic and began to decline. The January 21 is we're not quite sure what happened there. There was a big blip, but then it's dropped. So where the February data we know is 19 weeks. So it's beginning to flow back towards where it should be. That said, with the return of schools, we anticipate the waiting times to go up again. So very fluid is what I'm trying to say in terms of demand patterns and activity patterns. If you take us forward, please. One of the things that we are particularly concerned about is eating disorders. You'd have seen from the report that one of the changing patterns in problems being presented during the lockdown and during the time in which schools were shut was an increase in eating disorder problems. There was a decrease in bullying, an increase in eating disorder, and an increase in self-harm. And the pattern and presentation of eating disorder is also changing, not following quite the same ways that we traditionally have classified such disorders. And so we're being really quite worried about eating disorder. Even before COVID, we were trying to make sure that we improved services for people with an eating disorder. And so there have been some wait times specifically set for children, young people to be seen with an eating disorder because it is clinically so serious. And I'm pleased to say that Derbyshire and Derby are doing very well in relation to our targets for eating disorders. There's slight fluctuations, but we are largely meeting our targets. We are wanting to invest in the year ahead on some of the preventative services, the education and the information about eating disorders to families and to schools, to pick up on some of that rise in concerns in behaviours. We're working with NHS England around some of the bedded provision that there is nationally, which is commissioned by them on a regional basis. But and we also want to increase our home support capabilities, and I'll come to that in a future slide. You take us forward, please. So I mentioned targeted intervention services, which are run by Action for Children in Derby and Derbyshire. And you will see that the city, the approximate waiting times now is 8 weeks. It's much higher than it was, but it's still at 8 weeks. If people do wait any longer, they are contacted and offered digital and group work and other opportunities. And clearly, there are many people who just want to have the one-to-one service. So that's the one-to-one wait time. There is also groups that are being running for individuals. And then we have parent groups as well. So those three kind of major divisions, and that gives you the length of time people might be waiting for those services. It's important to say that there is advice available for schools on management before that time through our specialist community advisors and through the mental health teams in schools initiative, which we're building upon. But this is, as it stands at the moment, the wait times. Want to take us forward, please? So changing lives, this is the mental health teams in schools and the wait times there. You're talking about a week, maximum waiting time 2 weeks. It's a fairly new initiative, so we need to keep an eye on this. And you'll know that we've got 2 new schools we're developing during the course of this year, Noel Baker and Benrose. Helen, do you want to say a little bit about this slide, please, and where we are with the Changing Lives work?
Come on.
Yep.
Hello. You can hear my voice. I'm not sure if you can see my video. Yeah, so the Changing Lives work, the staff have been recruited in January and they have started their training. The actual delivery will start in May in those 2 school networks. So that's definitely progressing. With regard to the waiting times, I think what we're finding is that this is again because of children not being in school, it's been more difficult to generate those referrals, and so as children are coming back into school, we will be expecting there to be more involvement with Changing Lives.
Our special school in Derby has the team, doesn't it? So that's these are the wait times largely for the special school that is currently on the pilot, not the 2 new ones coming on in May. Yeah. Okay, take us forward, please. So we've talked previously about our digital offer that children can access. And this is a diagram that shows the capacity and how the use is being made up. You can see with the red line there what our capacity within in terms of what we've bought from that service is and where we currently are. So we have some space within that for more activity. And you'll be seeing that people are using this quite frequently for that sort of counselling hours, 955 counselling hours, and then 178 is around moderation, and that's the moderated chat type of concept. Do you want to say anything more about this, Helen?
I think this service will have participation workers who are going into schools and targeting those schools where we know we have more children with mental health problems. So they are actively promoting this as a service, and obviously since March they've been able to engage a lot more with schools and with teachers to promote the service. We've also been really targeting areas around kind of high groups of BME children, and those children that we know are more at risk. So they've been targeting those groups.
And we're currently out to procurement for a new digital platform. We're very happy with Couth, and there's a parental version called Quell, which is open really to all adults, but it's really designed for all adults, but we focused it on parents, and we're going to be doing some more work in the system about how we think we should take that part forward. But we see the use by young people of the Couth capabilities increasing, and we think will go up as schools return and they get to know more about it. Following the conversation we had here last committee meeting and elsewhere in safeguarding boards, we are planning to put resource specifically aside to help improve our comms. This is not because we haven't advertised, we haven't told people about these things through various websites and various offerings, including the local send offer, but it is something about how we could try and get this focused on children themselves and the digital platforms they use and the means of communication they have. And we're working with children directly in order to make that happen. We're doing some work with an organisation called MH2K, which is a group of citizen researchers, largely drawn from Derby children, to help us find out how we can make things focused on them in terms of getting the message out. If you take us to the next slide, please, Lindsay. So we begin to start thinking, therefore, about, well, what should our plan be? And in our plan for children and young people, the first thing we want to do is increase the capacity for crisis responses, and we want to deliver something called intensive home support. We feel there's a big gap between the ability to put wraparound care around the most troubled children or children needing the most supervision, that means that we've either got people being struggling in foster placements or struggling in placements which could break down, or we have children who are staying on our paediatric wards who shouldn't be there at all. And we need to have some way of being able to provide wraparound support. The first part of that is to provide the health offer around that, and we'll come on to the investment for that in a minute. But going beyond that, we want to also do some work with our local authority colleagues around the community support offering that's available, because really the two things go hand in hand. We do want to continue to reduce wait times, and one of the things that we have done, knowing it's so difficult to recruit staff, as we discussed last time, and our thanks to Councillor Lind for raising that nationally, and I think it has been recognised that they need to invest in staff training and support. One of the things we've done is invested in a digital offer to support our CAMS teams to provide some of the CBT and neurodiagnostic assessment work which can be done online. You can have staff employed anywhere in the country offering this to children, and so we're working with a company called Helios, who provides specialist staff to provide interventions, and that's going to help us tackle those children who are waiting for some therapy on waiting lists. So that's how we're going to practically do that right now, in fact. We're going to continue our workforce capacity investment with CAMS. We were going to try and work together across Chesterfield Royal and Derbyshire Healthcare, who both provide CAMS in Derbyshire and Derby, and we want them to work together around workforce. We want to develop our eating disorder specialist services to give us more intensive interventions, but we also want to do some work around the voluntary sector and schools, so we're trying to cover both ends of that concern. We are working with NHS England to try and improve access to Tier 4 beds. We're very concerned about our access, and there are children who wait to try and find beds because there's a national shortage. This is not a Derbyshire unique problem, but it is a difficulty we see with children waiting to find beds, particularly where they are with new types of presentation we're seeing, where people are presenting with eating disorders, but where eating disorders almost become a form of self-harm. So it's very significant, it's very impactful, it's affecting their physical health, it could be life-threatening, but it isn't an eating disorder caused by something like anorexia nervosa, for which the wards have traditionally been set up to provide for. So we're having to change the way in which some of the NHS England commissioned wards operate, and so that's taking some national thought, and people have put their thinking caps on about how that can be done. We are wanting to develop targeted services. So we've talked about targeted intervention services. We know we need to continue to grow those so we can continue to keep these waiting lists down. We want to work with schools and prevention services around the whole school approach, and you've seen that we've got the 2 new schools coming into Derby. There's been announcements that yet more money is going to be made available, so we are expecting to have the detail of that soon, but it may be there might be even a further wave. To be honest, we're not sure. We've been told to expect some more resource, but we haven't got the detail yet. And we want to introduce some core standards across Chesterfield Royal and Derbyshire Healthcare so that we can get some consistent quality and clarity for our investment in these CAMS services as we go forward. As we move towards an ICS, we want to try and have some consistency across the footprint of what we're looking for and how services should be delivered. Take us forward, please. So I don't know, Helen, if you want to interrupt my monologue and perhaps say a bit about our investment plans.
I can do, Dave. So as you can see, we do have investment coming into the system that we're able to use for the crisis response and the community services to really deliver and enhance the pathway that we already have. So the key aim is that we build on those foundations that we have made over the last few years during the Futures in Mind programme, and work with our partners to do that. One of the key things we're looking to do is to expand the resource around crisis response, and to look at that across not just sort of mental health, but for children on those pathways around autism, eating disorder, mental health and complex behaviour, so that we have one whole service that can support children, whatever their needs or complexity of needs might be. So the initial phase is that we have funding for 3 years that will be incrementally increasing, and the plan is that in the first phase we are particularly going to be looking at staffing up and increasing our health resource for this crisis response team. So we're looking to get more psychiatry cover, specialist CAMHS cover, increase staffing capacity for the intensive home support as well. So that service that will be able to go into children's home environments, wherever that might be, and add specific specialist care and support. We've also put in a strategic coordinator post that is going to support some of that interface between agencies that can cause kind of knotty problems and prevent children from flowing properly through different pathways. So they will have an interface, this coordinator, between the Tier 4 beds and acute units, and with the CAMHS services and with the local authorities. So we're quite hopeful that will help to ease some of the flow. We're also looking at specifically putting in children's mental health support into the triage for the 24/7 helpline that's currently being run by Derbyshire Healthcare. We do have specific children's service support on the end of the helpline at the moment between 8 and midnight, and we're currently kind of reviewing what the impact of that is, as to whether we then cover through those sort of hours through the middle of the night. As Dave's already mentioned, we're also going to be increasing the support that we have in our eating disorder pathway, specifically to the supporting the paediatric wards, to be able to give them much more kind of wraparound specialist support to those children there, but particularly then to be able to move those children back into their home environments with intensive specialist support, and also to be really looking at trying to prevent admission as much as possible by putting in more support earlier to prevent those admissions to paediatrics. We're also looking to invest, as Dave's already mentioned, in the CBT online, so I won't cover that again too much, but that's a non-recurrent resource that we anticipate will really help support reduce some of the waiting times that we have in our core CAMHS services. The communications, again, I think that Dave's touched on this around us having a specific strategy and a worker who can really help to make sure that communications to our children and young people are appropriate, that they're engaging, that it's the right language, the right forums for engaging and communicating about a mental health offer, but also that there's a strategic approach to this, so that we filter the information out through all the right pathways and to all the right agencies and teams on the ground. So there's a lot of work going on there. We've also got, we are looking to develop services that we already have a number of projects around trauma-informed work and working with the Youth Offending Service. There are psychology posts and work that's happening in that team, which is currently time limited because it's a pilot. So we're looking at we're due to receive evaluations from Nottingham Trent University on those services, and we'll be reviewing those and looking at how we can potentially make those more substantive. And finally, I think that last time we came, we might have mentioned that we were putting forward a bid to, as a regional bid for the Framework for Integrated Care, which again is around really supporting a trauma-informed culture and supporting staff to understand trauma-informed approaches. Unfortunately, on this occasion, we weren't successful with the with this first kind of bidding round. We're seeking some feedback on this in the next couple of weeks and trying to understand and find out if there will be other waves of funding for this, because we understand this is the way that Health and Justice are wanting to move forward their transformation. So we're hopeful that we'll be able to reshape our bid that we put in at Christmas time, so that if there's future opportunities, we'll be able to put forward and hopefully be more successful in seeking resources there. Do you want to move on, please? Okay. So this is final slide that I think that came up from the last discussion that we had at Scrutiny, where there was a particular question around children and young people who are not attending school and how they access mental health support. So we have been having conversations with between, I think, Health Commissioning and City Local Authority around how we can improve some of those connections and support services to work more closely together. So we're just starting some of those processes, and the new Changing Lives mental health support teams will particularly be looking at identifying those children that are known not to be attending school, so that they can, as part of their offer, make sure that they target those children with support. Also working with the in-year fair access team and exclusions team, looking at ways of again making sure that, as I said about communications in an earlier slide, it's how we get that information to those children and to their parents, so that they have the same equal access to the opportunities and the services that we commission for everybody. So we'll just looking at, in consultation, we will be working with Action for Children, who are delivering the mental health support teams from April, and the local authority to understand the children who are not school educated, to understand from them what their needs are, how they would like to be better engaged with the mental health support that's on offer across Derbyshire. So we're looking at doing that piece of work with local authority colleagues sometime in Q2 of the coming year. So yeah, and I think that the final point there is just talking at how we have been talking to the head of the virtual school as well in the city and county, and something that we're looking at there is that the children who are on the books of the virtual school, that we're looking at them having a kind of priority passport system, so that those children can access the early interventions through, whether it's Changing Lives or Build Sound Minds, that are available on a little bit more of a priority to be able to get the interventions that they need. Okay, I think that's the last slide.
Yes, yeah, then we're moving. Yeah. Then the other area of interest for the committee last time was around neurodevelopment, and we were showing how the waiting lists in this are skewing some of our other figures. So this slide really does segue well into the SEND conversation you've got later. One of the written statement of action requirements is to reduce the waiting list for neurodevelopment assessment. That's been moved on a bit as we've understood that really what parents and carers are saying, that they want help, timely help. It's not necessarily about a diagnosis, it's about the support in a timely way. Now, with the first graph here shows the sort of a red line shows you what's been happening to demand. The purple line at around about that 1,000 level is the number of young people we think we ought to be seeing that are coming through each year with neurodevelopment needs. The green line is our capacity in the system to see people. And you can see that we are now way exceeding anything to do with prevalence, the people that we should expect to see, and our capacity. And that's why, in a nutshell, our waiting lists are going up. So we're actually probably providing the wrong kind of thing, and we're clearly causing quite a lot of frustration, as many of these people being referred will not get a diagnosis and don't actually find at the end of it that there's necessarily any more help for the thing that they're concerned about. So that's why our proposals really are in two stages. The first thing we're doing is we're investing over £600,000. In fact, we've added to it since we did this slide. So it's close to 700, 800,000 now. We're investing in buying increased numbers of assessments, which will be managed by our NHS providers in order to get us back to the pre-COVID position, to overcome, actually see people get the assessments down and to address that waiting list. But that's seen as a temporary fix. In a sense, it's overcoming the issues of COVID. What we then also want to do is some work around managing the demand, and that's through a much more root and branch review of what service do we want in the future, where do things fit together. And there is a piece of work that is being led jointly through the SEND boards for county and city in a co-produced way as to what the pathways that people actually want should look like. Can you take us to the next slide, please? So we have a vision for that, which this comes from the SEND statement. We want to have a different kind of wide-ranging pathway that supports children and young people with their needs at that much earlier stage. We're talking about early help was the phrase that's often used. We want to get to a situation where we're helping children and their families get to a point where they can live independently and thriving as children and adults. That's what we're looking for. So we're trying to move away from a diagnostic focus into a thriving focus, which is quite a significant shift for us all and requires some new ways of thinking. And of course, we are become aware that there's lots of resources out there, but people don't necessarily know how to access them, which is a point the Parents Carer Forum, who are thoroughly involved with this, keep making to us. If you move us on, please. Now, last slide, I think, glad to know, just shows you how complex this is. This is the model that the group that have been working on this have got to, and I think really all I want you to take from this is complicated. That there are many pathways, not one pathway, but we've moved from a funnel shape where everything led to a diagnosis and into a series of assessments and the idea that we should have clinicians represented by that green diamond on its side involved at various points across the pathway in a proportionate way, helping what we call that graduated pathway. So there's a lot of work still to be done. It's becoming increasingly complex, and we're going to have to change this slide soon because there was just too much being stuck on it. But this is the latest slide from the SEND work stream that we're using, so we didn't want to use a different one just to avoid complications. But you will see considerable amount of work going on trying to understand what it is that people want, where they want it, how we can best work, with a commitment on all sides to change what we're doing. And so that's our kind of a longer term aim on this particular piece of work. I'm going to stop there and throw it open to questions. Thank you very much, Lindsay.
Okay, thank you very much, David, and thank you, Helen. First of all, wow, the work going on is absolutely fantastic. It's lovely to see. It really is, that level of commitment and dedication from the team to ensure that children and young people in Derby are getting the very, very best with the resources we've got available really does shine through, I think, for me. I think you're all doing a fantastic job. You really are. I just hope the government recognises it and gives us some more money to ensure that we can meet demand going forward. And I think we're all quite right that we need to be watching this. We need to be proactive. We need to ensure that we're looking for any changes in that level of demand and that we're able to respond to that as best as possible. And I'd like to thank yourselves and the rest of the team for all the fantastic, amazing work that you're both doing. I really would, and I'm sure the board will agree. Any questions?
Chair, if you don't mind.
Councillor Hazelgrave?
Thanks very much, David and Helen, for a kind of American's tour there. And certainly on occasions kind of going through things very quickly. So there's a lot to absorb, but it did give us a good flavour, and I would appreciate you sending us the slides so that we can look and digest maybe a bit more thoroughly over time. One of the things I do think we agree with you as councillors is the whole issue of demand management on the neurodevelopment thing, because it just is, there must be a complete breakdown of trust between parents and the whole system that's there to support them. But there's also that issue, isn't it, that if you get a statement or you get a PSHE, you get help with exams. You get an extra, I think you get extra time, don't you? 20 so much long extra for the GCSEs and stuff like that. And of course that could be really important for some pupils. So I'm glad to see that you're trying to grapple with that, but I agree with you, that in itself is very complex. I hope you can get somewhere in doing that, but I suspect it's not a job for you alone. There's a whole raft of people that need to be involved in that. Do you consult with user groups such as your MHTIS and with young people who have been referred to see how you can you may have referred to it, but to see how you could better serve and meet their needs, with this whole digital thing? As you say, it's quite it's quite refreshing that they're more prepared to meet in that kind of setting. Although I don't know if it's ideal for diagnosis or clinical work, but anyway.
Yes, the digital officer works well for some, doesn't work for others, which I suppose is the answer you'd expect, but that really is the case. We're finding that the feedback is for adults who fed back to the trust, there's about a third of people want us to keep that and really want to carry on using it. It's their preferred mode. It suits them. It's easier for work, it's easier for appointments, you don't have to travel if you've got family and so on. So a good group of people really like it. I'll let Helen talk about the MH2K work, which is in relation to the digital offer with children and what we're trying to do with crisis. But Pauline, who's on later, will know fully well about all the work that's going on around SEND and the engagement with our colleagues around how we make this new pathway work, and the Parent and Carer Forum, who've been helpful and really concerned that we make progress in this area for the reasons that you've given, Paul, the Councillor Hazelgrave. It really does, you're spot on. It has caused a breakdown on trust, and it is one of the things we need to rebuild. Yeah. Helen?
Okay, I'm going to pick up. So I don't know if you're familiar with MH2K. They're an organisation that work with children and young people between the ages of 14 and 25 and recruit them as citizen researchers. So we currently have on our project, I think it's 30 citizen researchers which who work together, and they take on various projects for us around engagement. So they've done 2 for us in the last few months, one around our digital procurement. So they have come together and formed a focus group where we were able to attend, and they ran it themselves. They looked at some key questions, and they were able to provide us with a lot of information around what good digital offers would look like, what would be accessible to them. They're incredibly professional and incredibly insightful and respectful of each other, and they didn't just think about their own needs, they were thinking about other people that they know. So it gave a really good broad kind of picture to us of what different age groups across, as I say, between 14 and 25 might need, and from that they produced a report for us that we've been able to use, and we will be including that in our specification. They also helped to shape the SurveyMonkey questionnaire that we sent out for the procurement, to make sure that the questions were appropriate for children and young people, that we would get the best responses. So they really helped us with that. They've also ran, there's obviously a lot of work that we're doing on crisis. So they've ran, to start with, we've been looking at the 24-hour helpline and asked them a particular question around accessing that and how we can promote the 24/7 helpline to our children and young people, because at the moment, because it's an all-age offer, it's not that particularly inviting, the kind of communication material maybe, and also it's phoning, which we're very conscious that a lot of our young people, if they're feeling perhaps a bit insecure, feeling in a crisis, they don't always reach for a phone to talk to somebody. They're more likely to do a messaging and communicate in a different way. So they were able to give us a lot of feedback on that, which we will be putting into the service developments. So MH2K have been really valuable and will continue to be as we develop the services.
I did want to ask another question, Chair, if that's all right. We know nationally, don't we, that there is a big increase in mental health issues right across the age spectrum. But the real concern is with younger people, because they may not have developed any strategies to deal with those. It was really stark for us to see those figures, the increase in the numbers of eating disorders and suicide ideation, and the drop in bullying, which I'm assuming is bullying as referred from school, in a school setting. But of course there is cyberbullying going on, and whether that's a separate category, you would imagine that since there was so much cyber activity among young people and engaging in virtual classes, etc., that there would have been some kind of cyberbullying kind of fallout as well, in terms of mental health issues and the impact it would have. Maybe that's not got into the kind of picture yet. But I mean, that's certainly the suicide ideation thing, that's just the tip of the iceberg as well, isn't it? Because those are people who have actually disclosed that they have those issues. So I hope the MHTIS team are really, and all colleagues in education are really looking out for the signs. If there are any that you can kind of say, this is a list of things that would indicate. But they're the ones who know those young people the best. So I'm just wondering if you could maybe talk us through a bit more that increase in terms of issues presenting for young people in Derby and the immediate area of Derbyshire.
Oh, Dave, I think you're on mute.
Sorry. Yes, we're happy to do so. We can't give you the data from casualty and so forth just yet, because that data hasn't flowed through yet, with the schools only having gone back, so we're still behind ourselves. But anecdotally, we're hearing across the East Midlands a rapid increase in the number of children presenting who have self-harmed. That is reflective of what our digital providers were telling us they were talking to them about. So this emotional distress, it's a signal of emotional distress, and often this is about creating resilient schools and communities. It is often about allowing the opportunity for children to express things, to be listened to. It's often not a need for particular in-depth therapies, but it is about that listening. It is about that general support, and there's a bit of a catharsis going on as well. I think we feel that as adults as well as we begin to open things up, but there is some real vulnerabilities being expressed. So I think we're yet to see the full impact of that, but we are certainly seeing it reported, and we are seeing our liaison teams. We have teams in the ED departments of both Chesterfield and at University Hospital. They are reporting seeing more young people coming through. I mean, the good news, we have got these people in post, and so they will be seeing them. These children are being reviewed and being seen, but that is a concern. I think and we need to know whether that's going to be something long-lasting or whether it will be temporary, and we don't know the answer to that. The eating disorder thing is similar. If it's been caused by lockdown, you'd expect it to begin to diminish, but a lot of these behaviours are learned, and you get patterns of behaviour amongst children and populations, and our big fear that this is a cultural change in how things are being presented. So we don't know the answer, but we think that will come. That's been the case. Certainly, organisations such as First Steps, a really good charity, does lots of work with children with eating disorders in Derby and across the county. They're reporting that these things are on the increase, and so we are wanting to work more with them and other providers on how we do the education and support for schools and help for people to know what to do, because I think people feel powerless and worried and want to know how to help. So we think these targeted intervention services are key to that, really. It's where you perhaps need a therapist, but you don't need loads of other wraparound care. You need some support in a focused way, but you don't need the full range of a multidisciplinary team and professionals and social worker and everybody else working with you. So that's why we think the targeted intervention is so important. And of course, that's why their waiting lists have shot up. We're not talking about weeks at the start of this. We were talking about days for the waiting list, and we're now talking about weeks. That's a reflection of those concerns.
Thanks very much, and thanks, Chair, for the indulgence of letting me ask a second question.
No, absolutely. Any more questions? No, can we move over to the recommendations now then? So recommendations 2.1, 2.2. Any further comments or recommendations following discussion? Would we like to see an update in a few months as a board to see how demand and how things are going as things start to open up a bit more? Very
much so, Chair. Yeah, I think it's reassuring for us, isn't it, to get this kind of news and kind of an insight that the team is very agile and responsive and open to change and to acting quickly. So yeah, definitely. And I'd really like to thank David, Helen, and all colleagues in CAMS, for their immense work. That they're doing a really important work.
Thank you. Yeah, so we recommend. Is that okay then, David, that you can come back in the new year, in the new municipal year, in a few months' time, to give her an update of how things are going as they start to open up and how demand is going along and what the response to that is. Is that okay? Yeah. Right. Are we all happy with that as a board? Take silence as no objections.
Councillor, then could I recommend we come in August, because that way we could bring to you then our draft plan. We talked about that needs to be published. You'll have a chance to comment on it then before its final version, which I think councillors might find helpful.
Brilliant, thank you. Yes, so we'll recommend that they come back in August then. So we're all happy with that, yes?
Yes, Chair.
Right, no objections. So thank you very much, David. Thank you, Helen, much appreciated. Okay, so now moving to item 6, monitoring safeguarding practice. I think that's Sue-Ann Lim. Pass you over to Sue-Ann.
Thank you, Chair.
Thank you.
Good evening, children and young people scrutiny members. I'm just waiting for a presentation to be put up.
Bear with me, Sue Ann. I'm on the case. Oh, got the wrong one. Oh, sorry. Sorry. Could you just talk amongst yourselves for a few minutes? Disaster. Bear with me.
Okay, well, I can make a start on the report without the presentation. For those that don't know me, I'm Sue Ann Lim. I'm the Director of Early Help and Children's Social Care, Derby City Council. And the Monitoring Safeguarding report that you've received details 3 areas of practice that provides us with a really good indication of how the service is functioning and how safe services are. So the 3 areas that I wanted to focus on was a social worker survey that's recently been undertaken, pressures and performance, and then our work around keeping babies safe. So essentially the survey, which is detailed in the report between 4.1 and 4.4, was undertaken back in December 2020. And it's really timely because we hadn't done a whole group staffing survey since the summer to inform our future operating model. And the survey concentrates on 8 employer standards for social work that are outlined in 4.2. And if you have got the report up in front of you, it's coloured and it's RAG rated, and the first column is Derby, and then we're matched across to the East Midlands and then to the national. And essentially there's a really good uptake from Derby social workers. So 41% of social workers took the time to complete, in comparison to only 10% of social workers across East Midlands. And for me, this is a key indicator of just of our positive engagement and a good health indication of the organisation. And you'll be able to see the overall scores are either consistent or better than regional and national average of the 13 categories, and those 13 categories cover 59 specific questions. So what is it telling us? So I mean, on the upside, social workers in Derby are consistent with their regional and national colleagues, and in our case, the employer, Derby City Council, supports a really strong and clear social work framework. We have social workers are telling us that there's good strategic partnerships and a good understanding by the employer, and that's Derby City Council, of social work, and there is clarity around the council's importance of social workers and also the recruitment of social workers as well. Where we also fare well is the overall satisfaction and the desire to stay. So we're really a lot higher than both the regional and national average, and that for me is really significant, and that again provides me with confidence and assurance that staff are proud of their job and proud of working in Derby. And that is despite the fact that there are some ambers in there. So you will see that we have got some ambers, and ambers doesn't mean that there is due concern. It says that you perhaps should monitor those areas rather than some direct action. And those areas that are amber are, of course, significant pressures that social workers are under in respect of caseloads and around their own well-being through to COVID. And as a senior leadership team, we've obviously looked at those particular areas because we would want everything green, of course, but clearly the voice of our social workers, we need to listen to those. So we have put in place some areas to address some of those actions, and they're detailed in 4.4. So in terms of the caseload aspect, we have put in place monitoring of and put in place a commitment to an upper maximum caseload and minimum caseload. And the details of those caseloads are reported through to the Director of Children's Services, to the lead member and to the Chief Executive on a monthly basis. And where there is need for additional resources, those are agreed at that level. We've also recognised that clearly there are issues around emotional health and well-being and being ability to be able to do continuous professional development during this period, and that's been a very pressurised and key point that social workers have fed back. We have put in place weekly lunchtime reflective sessions for social workers to join, A, to encourage engagement, but B, as part of attendance that they can put down as part of their registration. And that's been a whole service approach to leading those sessions. So, for example, I have led a session, heads of service have led a session, and the Director of Children's Services has also led a session. We've also enabled really flexible office-based working to help with isolation and the time, and to ensure that there is engagement and connectivity with workers. And we've made sure that that's available wherever a social worker needs that opportunity. But I think the main thing that has helped with anxiety for the front line is ensuring that we have made sure that all eligible frontline workers, not just social workers, but those that are visiting homes that potentially have access to priority elderly groups and clinically extreme vulnerable children, that they have all had access to vaccinations. And that, again, has allowed them to feel more confident in working in what has been, a very, very, very anxious period and a very pressurised period, being on the front line. So if we move to the next slide, the next part of the report talks about pressures. And I picked out two particular pressures for this quarter since we've last met, and there has been no surprise an increase in demand, but particularly in that higher end group. So we have almost 4 stages. So there's the early help, there's the children in need, there's children subject to child protection plans, and then where it's not safe for children to remain at home anymore, then we bring them into care. And we've seen quite a significant rise in children coming into care in comparison to the same period last year. So that's a rise of 11%, and 65 more children are in care, and we currently have 549 children in total in care in Derby as of this morning. And similarly with child protection, we have had a 20% rise in comparison to this time last year, which is quite a significant amount of children subject to plans. And again, senior leaders, the Director of Children's Services, lead member and Chief Executive are regularly updated regarding these acute pressures, because these are very intensive interventions for children. So it is very concerning that these are rising in this area, and this is no different to what we're seeing nationally. So we're not unique in Derby. There are more children arising, and it is a direct result of COVID that more children are being made subject to child protection plans, and more children are coming into care. Thank you. Next slide, Lindsay. So in terms of performance, by the end of February, we've still overall remains very positive despite the pressures, and that is because of the good support and injection of resources where that's needed. There is one area that we're seeing some slippage, and it's probably no surprise that's the bottom one, regarding timescales for initial child protection conferences, and that directly relates to the volume that we've had through. And particularly in the last quarter. And in terms of the reporting in December, the 59% was 95% for child protection conferences. So we have dipped quite a bit in that area. And what I will say in respect of assurance to the board is that no child is left unsafe. Any child that is assessed to meet a child protection threshold doesn't wait to the conference before accessing safety planning and intervention if that's needed to be put in place. The social worker assessing the need will put those interventions in place or additional visits until the conference, and this is monitored by a team manager. So we don't wait until the conference. Okay, next slide, please. And the final area is around a new initiative that we are developing around babies, and this is directly linked to reducing incidents of, reducing serious incidents. No local authority wants to manage a situation where a child is injured or dies through deliberate neglect and abuse, and the current criteria is outlined in 4.5 of your report, and we are really fortunate in Derby that our incidents, our serious incidents, remain very low and they're very rare. However, over the last 18 months nationally there has been a rise specifically in child deaths or serious harm to very small children and babies, and the national report of the Child Safeguarding Practice Review panel by the DFE highlighted a really unacceptably high number of deaths in babies, with abuse and neglect being a factor. And nationally, they reported over 40 in a 16-month period. And so this is a national priority. So where is Derby in all of this? So I've attached the strategy that's recently been written, and since 2015 we have had 13 serious case reviews, and of course we're now a joint with Derby and Derbyshire. These are the joint numbers, and there have been 13 case reviews of different types, either local reviews or rapid reviews, where a baby has died or experienced serious harm as a result of abuse and neglect. And the numbers for Derby out of that 13 are 3. And the risk of a baby suffering harm is significantly increased because of their development and vulnerability and total dependency on their caregiver for their welfare. And the reviews outline, key things around domestic abuse, parental mental health, parental substance misuse as all stressors occurring for those adults in the families where harm's occurred. So we want to make sure that we are absolutely on the front foot, and we do not want our numbers of injured babies or non-accidental injury to children to rise. And we have a joint partnership now, and the statutory members of the local authority, the police and the CCG have endorsed and supported as a key priority to ensure that we absolutely focus on prioritising keeping babies safe. And I think this is particularly pertinent during COVID, where a number of babies are not seen as regular as they would be. So the priorities are set out in the report in terms of having a whole partnership approach, and I think, you know, when we talk about issues around children, it's very rare that one agency alone can manage issues relating to either the topic that was talked about before and what will come next, and particularly safeguarding. This has to be a whole partnership priority. The Chief Officer Group are wanting to ensure that, you know, that there is assurance of managerial oversight, so that we actually can ensure that there is improvement and a reduction of harm to babies. Because whilst we haven't had a huge amount, it is significant, and in terms of the joint numbers across Derby and Derbyshire. And that there will be a strategic lead, and that strategic lead has been appointed, who is the dedicated safeguarding nurse and chair of the Child Death Overview panel. So Derby has adopted the Keeping Baby Safe strategy, and it's attached to the appendix. There are 3 objectives: safe sleep, safe handling and safe space, and the whole training and strategy is based around those 3 concepts. We have our own champion who's helped shape that strategy, and the relevant training package that is now open for all multi-agency practitioners to attend. And as additional measures, we have also prioritised, and we continue to do this. We have directly visited all open baby cases under the year of 1. We did that at the beginning of the year and continue to do that, and regular direct visits are maintained, and this is now built into our new referral process, so that we do actually see those children on a regular basis, and this is best practice. Okay, I've finished the presentation, so I'm absolutely open to having any questions, if anybody has any questions on either of any of those 3 areas. Thank you.
Thank you, Sue-Ann. Right, any questions?
Yes, Chair, if I may.
Councillor Hesgrave?
Yeah. Hello, Sue-Ann. Thanks very much for a very thorough report. One of the things, you know, the red line, the tensions, that must be a concern, because, you know, obviously there's been an increased workload. There's a lot of pressure. There's been a massive number, a higher number of cases of children being referred and coming into care of the authority. But it can't become the new normal, can it, that people work at that kind of level? Because we're looking at burnout, we're looking at impaired efficiency, we're looking at increased supply costs. So I hope that, you know, that this every effort is made to deal with that. It's rather very saddening to hear this national phenomenon, if you can call it that, of babies and, you know, very young children ending up either seriously ill or actually as fatalities because of the care or lack of care of their parents, you know. So I'm glad that there is a concern about that, and I'm sure we're working on that as a local area, and the health visitors have got their part to play, and it's a kind of multi professional team that needs to work on that, isn't it? You know, anyone who contacts parents with young children needs to be in the loop with that. Everybody. Yeah.
Absolutely. Yeah. Babies are so vulnerable. Absolutely.
Yeah. Yeah. Well, I just wanted to say that. I think really, but you know, it's reassuring that we're on to that, and we're doing what we can to make sure the awareness is there, and there are strategies in place to mitigate the danger to you know, our most vulnerable citizens. Let's put it that way.
Okay. Thank you, Councillor.
Okay. Thank you. Any more questions? No, over to the recommendations now then. So
just to note the report, Chair.
Yeah, it's just to note the report, isn't it? So we're all agreed that's noted.
Very much so, Chair, but I do think we need to revisit the issue of the surveying, even if it's an internal survey of our social workers, and anyone else who's connected with social work to see if this tensions issue, as well as anything else, is if there's been a move in it. But obviously that might be a bit later, and you might be planning to do that anyway. So, but we'd love to get a report back on that.
Yes, I mean, in terms of the tensions, I didn't touch on that, but it is in the report, and it's not necessarily just for the local authority. It's all partners. We're all being asked to do more with less, and I think it's yes, we're trying to ensure that where possible, we rationalise work, or we make things more efficient, etc. But it's an ongoing challenge that is not just within social work or children's social care. It's across the board, isn't it?
Yeah, so we're happy with the recommendation to note the content of the report and current pressures. Thank you very much.
Thank you.
So we're moving on now. Thank you, Swan. Moving on now to item 7. So we'll move over to Pauline Anderson now for the Send Focus Progress on the Written Statements of Action. Thank you.
Hi, thank you, Councillor Lind. Good evening, everybody. I'm just going to share the content of I am going to attempt to share the content. Can you see that? Is that coming through, Danielle? No? I sometimes have problems sharing with Skype, I don't know why. Am I able to share? Because it's not giving, doesn't appear to be giving me the option.
No, you're not, Pauline.
It says my notes on managing content.
I'm making you a presenter. You're now a presenter. Sorry.
Yeah. Share my desktop. Thank you.
Thank you, Lindsay.
Thanks. Hopefully you should be able to see it now.
Yep, it's all there. Good.
Good stuff. That's a relief. Right. Well, I mean, as you already know, there was an inspection of the local area SEND, special needs, by Ofsted in June 2019. And as a result of that inspection, the local area was asked to complete a written statement of action, which is a plan as to how you will remedy the significant failings within the local area at that point. Now, the written statement of action was actually approved on the 17th of December 2019. So there was quite a gap between the inspection, the report coming out, putting together the plan. These things take time, and since December 2019 we have been specifically working on reporting on this written statement of action. What I'm sharing with you tonight is a detailed report, but actually one that it is a bit of a formal report, and we used it for a meeting with the Department for Education, who are monitoring us before we are re-inspected, and we also are monitored by NHS England Improvement Team. So they met a group of us last Thursday and went through this report. They specifically asked for it in this format, and I haven't adapted it because we just, there is such a huge amount of content. It is quite complex, but I'll talk you through it. Just to say that Ofsted is now opening its inspection window and has told us that they are hoping to re-inspect from the summer term onwards, 2021. So we are due a re-inspection as a local area in June 2021. However, they may have fallen behind with inspections, and it may come later in the year. I am going to plan as if they are coming in June. So that's the kind of background to this report. And it's, as I said, what we presented last week. So it's quite formal, and it explains how in each section the actions have been taken, and I won't read them all to you, but that first section, failure of the local area to take the joint commissioning actions required to implement the reforms across education, health and social care. So the local area being the council really, and its commissioners, and Dave Gardiner, who you heard earlier from the CCG. They are they are the reporting officers on this, and actually working together on bringing together a SEND data and quality dashboard, which has actually been produced, and moving this through all the SEND boards, which are the new governance, SEND delivery board, SEND local area board, and the impact and analysis board. I'm very happy to say that a new SEND analyst who's in the data team has recently joined, so we'll have more capacity. We do need a specific analysis on SEND, and it does take quite a lot of work, so I'm very pleased to say we have that new capacity. Again, on section 1, producing a single operational guide to defining SEND processes. That is work in progress, but to be finalised against a revised deadline. A lot of work has gone on beneath this, but I think we do need more time to present to parents and include it in the local offer. So this is to be presented at the March delivery group meeting, which is this week. Still on section 1, developing a clear joint commissioning plan based on a commissioning strategy that is completed. The plan has been approved by the boards. It's been developed with parent groups. It's been developed with health colleagues and across the whole council, and is responding to what parents say they wish to see. And those priorities are improving the visibility and accessibility of services, which Dave alluded to earlier, Dave Gardner. Consideration of support, self-help tools and strategies, because it's always those families that don't quite meet the thresholds for specialist services, or while they're waiting on waiting lists, nothing is happening, and that came through very strongly from families. So that's where we need to be putting the support. Reviewing specific pathways across the system. We are initially focusing on the neurodevelopmental pathway, and we started the first meeting to review that with a parent who said that standing within that pathway felt like standing at the Swindon roundabout, which was a complete mess. You might say it's a bit like Spaghetti Junction, and parents felt lost within it, and we are working with parents to improve that neurodevelopmental pathway, and we're in the thick of that work now, as well as the work that Dave alluded to earlier, and investing in the existing waiting lists, including also the mental health and wellbeing, graduated response occupational therapy. And then we've looked at joint commissioning and governance and enabling thorough governance there, improved working together and co-production. Again, we continue to work with our co-production partnership board with parents and a whole range of partners. So that's a really important slide there, and those 4 priorities are really important. Again, section 1, joint commissioning. Joined Up Care Derbyshire include a promise to review of community paediatric arrangements, including community nursing, etc. This has been delayed. The OT system-wide review is delayed a month, but is still expected to meet its deadline. And the community paediatric review, the data review is complete, and the findings are all going into the various boards, so it's on track against the timeline. Section 2, the lack of an overarching co-produced strategy. This is an area I'm responsible for. The new strategy I have presented at this board before for scrutiny, living my best life, the new SEND vision, and then the 5 priorities beneath it. So that is now in place, and we're developing a communication and engagement plan, and we have I have decided the best way to do that is to have a calendar where month by month we will be able to say how we're communicating that month and what our engagement is with the local area in that month. So we've combined a couple of work streams there, and that's something that we're doing quite a lot of work on right now. Section 2, again, you'll see that we've done quite a lot of work. You may have seen our local area newsletter. We're having those termly, so there'll be 3 a year. and anything to keep up the communication about the work we're doing in SEND. And this alludes again to the calendar events and sharing those within the SEND newsletter. The next newsletter request for content to be circulated mid-March. But I hope you enjoyed that. If you did see it, and if you didn't see it, let me know and I can send a copy of that newsletter to you. But it's, you know, a great way of sharing with all our partners what's been happening in SEND. It just brings it to life. Then we have quite a lot of parts of section 3, which is the number of significant weaknesses in the education healthcare plan processes. Well, you know, we've done a huge amount of work there. Some work has been delayed due to COVID restrictions, and we actually obviously any work with school and working on school sites has been very difficult. The graduated response, however, has now started, and the training is being provided to 33 pilot schools, and the steering group is now in place, and that is moving ahead. That graduated response pilot is being delivered by 2 teaching schools, St Martin's and St Giles, and it's all about getting expertise from our special schools into our mainstream schools and supporting children who are in mainstream but with special educational needs. Section 3, again, same area. School improvement team are overseeing an inclusion dashboard. Jo Ward is leading on that. In fact, she invented it, and that work is well established and ongoing, and it's got lots of inclusion indicators. Very, very detailed piece of work, and we're using it to support and challenge inclusion in all our schools across the city. Next, we agreed that there'd be a flag on health systems in our EHCP, and we're reviewing the use of markers in health systems, and anything to do with connecting our systems to health systems is complex, but we're aiming to do that through the Liquid Logic rollout, which is on track. We're developing a revised process for annual reviews, and that is formed part of the training Senko training program. We've got new letters and materials for parents and an operational guide in development. The DFE annual review training has been attended, and we're adapting the DFE, some of the DFE recommendations. Now, as a digital process, this will not be in place until the delayed implementation of Liquid Logic, because Liquid Logic system nationally has had some new elements to it which are not yet ready, so that's beyond our control, but it is moving ahead, and that will include annual review elements within it. Again, back to the Liquid Logic workflow for annual reviews, and again very similar to what I'd said earlier about the deadline had been aligned with the Liquid Logic rollout. Moving on, ongoing transitions being delivered by opportunity areas. Looked at a lot of work there in terms of the opportunity area, managing the transition portal. There is a really effective transition portal in its second year now, transition between year 6 and 7, and has got a strong send element to it, which is really improving how we share information between schools. Also between year 11 and post 16, from the into Derby College and other providers. And they've got very good transition leads in our schools. This work is reviewed annually and is, I believe, going very well. We're moving to section 4 now, which is the long-standing systemic issues with waiting times to access some key services. This is complex, and I explained earlier the neurodevelopmental pathways and the single operating guide, etc. But I think it's really important to know that some of these timescales have been affected by the NHS being staff being taken onto the front line during COVID. However, the neurodevelopmental pathway work is going well, and I would say we're doing a deep piece of work rather than a superficial piece of work there. So there is some of it. The work is progressing with, but we're just working on impacts and an overarching timeline for non-recurrent year one plan. This is a health area led by Dave and his colleagues, which I'm presenting to you here. But it is very complex work. And again, it's subject to CCG and the Clinical Lay Committee approval. So there's quite a lot of health elements to this. Section 4, the long-standing systemic issues, again on waiting times, to do with occupational therapy services. Again, we've had to revise the timescales to track performance in wait times, and there's quite a lot of detail there. And there's some information there about wait times, and I'm afraid the longest wait time has increased from 187 to 190 weeks, again affected by COVID. School nursing services comes into this area, which is again a health outcome, but has been significantly impacted by the COVID pandemic. However, activities are taking priority, and there has been a review of the school nursing wait times, and work is on track to meet the deadlines. Again, health visiting services is again very much impacted by the COVID pandemic, as you can imagine. There's a February update which is about antenatal contacts and so on. But the work excluding the antenatal is deemed to be complete, so it's on track. Section 5, poor parental engagement with plans for the local area send provision and high levels of parental dissatisfaction. Becky Barker did attend earlier, but all of our parents involved are delivering parent groups tonight. So Becky has left some comments in the chat about her view of parental engagement and how we've been working, and we've done some great work together, and I think everything that we do now is co-produced. We just see ourselves as one team, and we're updating the local offer website. We've got some great videos and things of young people talking, and though we've got a long way to go, in my opinion, on the local offer, it is, I have to say, a Forth Road bridge job. It's never really finished, but it's constantly improving. Dan Marson is supporting me with that in the City Council. Web-based customer feedback and traffic light system. We're just about to bring in something called Bang the Table, which I hope you will all get used to using, and we're going to be working with parents and communities in getting easy feedback. I think it is affected by the pre-election period, so unfortunately I don't think we can. We should have been ready with that this week. We've just got a question with our legal team as to whether we can actually launch it during what has been previously called PERDA, pre-election period. Then we have a whole range of building on the development of forums, Senko networks, Send Ambassador forums to connect the voice of children and young people, and we have allocated children and young people's voice to a development manager who is coming back from maternity leave, and of course as schools have just returned, we're going to seize our opportunity to engage with young people through their schools as well. But we've got to do that in a secure environment, of course. Section 5 still, creating feedback, and we talked about the Shoes on Wheels and In My Shoes survey. But again, this is the platform Bang the Table, which is just going through its final stages of procurement, as I said earlier. But we have got continuous feedback from our parent carers as a voice for parent carers in the city. We also have many emails and comments from parents who are working with our SEND teams, and we also ask a series of questions at the end of a completion of an EHCP as to satisfaction survey. So we've got data there which tells us about how satisfied parents are with that process, which is actually improving over time, and as we are getting quicker and quicker at improving our speed of completing EHCPs. Again, same area, developing a quality assurance framework. Absolutely, we've got this overview that's been completed and reviewed by the impact and analysis group. I mean, it didn't actually have a set deadline within the written statement of action, but we set it ourselves, and good progress is being made. So there's just some work stream impact and summary reporting there, which is again very detailed. I won't take you through it all. And again, I'll just end with our logos at the bottom: living my best life, being the Derby Vision for Send. And one of the children in our co-production meeting said, if we work together, anything is possible. And he made this wonderful love heart from Plaster thing. So that's something that we really valued. And actually, it's the last time we were able to have a major get together with children and young people in schools and so on last February. So something that we very much missed. So I hope that's been a run through of the formal written statement of action progress, rather than the previous meeting where I was really talking about the SEND strategy. They are two different things. I'm happy to take questions.
Thank you, Pauline. Do we know when the liquid logic systems are going to be going live and rolling out, when we're going to roll them out?
Yeah, it's all to do with the national system, the national logic nationally. So they have given us mid-May as the time. I mean, we're ready. We've been ready for months.
Yeah.
But they just felt they could. Oh, apologies. Sorry. Yeah, done. Yes. So unfortunately, they've given us mid-May. We're all a bit frustrated about that, but I think it's unavoidable, and it's to do with their big systems. But it means that we're preparing behind the scenes really for the handover, and it gives us longer to work with our teams to do, to actually get ready and work internally. So no time is being wasted.
Thank you, Pauline. I think what really stands out is that change in that the attitude of local authorities and all partners to actually work in co-production, and there's been a real recognition of that, isn't there? Yeah. And I see in the chat that Becky, who came from Parent Carers, has said that there's been real positive change of the mindset of the LA there, and I think that needs to be recognised. And I think that level of co-production with all partners, actually, I think from health as well, there's been a real change in mindset, hasn't there? Yeah. And that recognition and of what co-production is. And that's fantastic to see. It really is. So, okay, can we? Any more questions? Any questions? Looks like we've got no questions tonight, Pauline.
Well, there's a lot of content there, and of course, we'll be coming back along the way with this, and hopefully, reporting on a positive re-inspection.
Absolutely.
I don't have any questions, but I just think it was reassuring for us to see that progress has been made, and there's been a really strong attempt, to engage with parents, and it's clearly bearing fruit. That's great for our children and for families and for the reputation of the authority. So it's great. Thanks.
Thank
Absolutely.
you.
How are we managing reaching hard to reach areas, Pauline? Are we managing to reach
individual groups or areas, do you mean?
Well, both really. Hard to reach.
We've recognised that, particularly working with families, that quite a lot of vulnerable families do come to PCT. So we've accessed additional COVID funding, and we're actually buying some additional. We're calling them SEND navigators. And they're actually mostly parents themselves who have children with SEND, and we're just training them up now in doing like a helpline to help to navigate the SEND system, because that's probably one of the hardest things to do. And we agreed that as one of our joint commissioning priorities as well, which came from parents. We don't know what's out there, we don't know how to get in touch with people, and we really need that support. Part of the support that we've given is to extend parental support groups, also working more with people like Vulnerability and Umbrella, and expanding some of their resources there. You might have seen that we have a new send bus. PCT have a send bus which is down at St Giles. So anything to do with, I think what for me it's about reaching out. It's not about us sitting waiting for people to come. It's about how do we get out there into the communities.
Absolutely. How are we utilising how is Sendias being utilised?
Oh yeah, they're fantastic. I mean, right from the beginning, Sendias came to us after the inspection and said, listen.
Oh, Pauline's frozen. Oh, she's gone off for a minute. I'll see if she comes back in a minute.
Can you hear me?
Yeah, you're back. Hi.
Yeah, Sendias. That's been a real success story. They are now involved in all the boards that we have, and I commissioned an internal audit of tribunals when I first became involved, and after that set up a tribunals working group with Sendias, our legal, our lawyer, and some of my team, Paula and Dan. And actually, we've looked at kind of mediation and how do we actually support families and not having them going through the grueling process of going to tribunal, but trying to solve, co-produce and find solutions sooner. That's been a huge success. And I've got to say, Sendias have been a very important partner in that, and lots of other. They obviously sit on the co-production group as well.
Brilliant. And they're still providing impartial support and advice, aren't they, to
Yes, it is impartial support and advice. It's just that there are places, there are times when families need the kind of, it's the mediation zone, isn't it, really, where a family actually agrees that we could probably sit together around a table and help to solve the issues rather than, to be sitting on two sides of the fence, as it were. But of course, once things, we have vastly reduced the number of tribunals, but a few are still going through. And of course, parents have their right to independent representation and so on, which we respect.
Okay, thank you. Any more questions from anybody? No. I'm going to move over to the recommendations now then. So recommendations 2.1 to consider the presentation, 2.2 to make any further comment recommendation following discussions on presentation received. So any recommendations? No. So we're all happy with those recommendations as is? Yeah. Okay. Yep. Thank you very much. Okay, so moving over to the next item now then, item 8, education otherwise than at school. Again, that's you, I think, isn't it, Pauline? Thank you. You're on mute, Pauline.
Right, apologies. Yes, this is only a short presentation, and I think it's fair to say that you and I have had a conversation, haven't we? Is that sharing?
Yep, that's sharing, yeah.
You and I have had a conversation because actually we've never really had a focus on this in the city. So I just want to, this is more of an introductory presentation, and really to you to give us a steer as to, where together we might want to go to with this as a city. So this is the beginning of something rather than the end of something. Thought it might be useful for people to understand what EOTAS is, education other than at school. And it's when a child or young person is unable to attend a mainstream or special school, maybe when a child has to attend the hospital medical school, or when a child is being educated at home through tuition and so on. But it's not elective home education. It's not the same as elective home education, which is where parents take their child out of the education system. So schools and hospital medical education, a child might have complex mental health needs. They may be school refusers and not responding to school life. They may need high levels of therapeutic support. I mean, they may never return into school. Often this is the case once they actually do go into school refusal, which is often in the secondary phase rather than in the primary, but it can happen in primary schools. And I think the important thing is our hospital medical school, we run that alongside the Prue and Kingsmead Special School. And we're currently looking at reviewing how it works, its curriculum, how many children are there, what the need is, what the growing need is. And I think this is very timely, Danielle, to look at education other than at school, because it's quite a complex picture. So an education other than a school package is something that we are aware can be designed. So when a young person has special needs and an EHCP, it is possible to design a package of education using tuition, remote learning, additional courses and experiences to meet their needs. This can be done in co-production with families and the young person, and the High Needs Fund can be used to provide the funding through their EHCP. They would not be on roll at a school unless a blended education is designed. And again, you've got to look at partly where the funding comes from, but really, for me, the most important thing is what's in the best interests of the child. And this can be right through to post-16. It's not just in statutory education. You can design packages of support and education right the way through up to 25 years old. So we have got no specific policy or approach at the moment, and I think that's probably what you've identified really, Danielle, which is helpful for me to know. This could be developed within the new SEND strategy, and I could locate it as we now move forward with that. So that it's certainly got people who can help us with this. It can be co-produced with parent groups so that we really have a citywide understanding of what we want to do. We can collect data and understand where our children are, what numbers are educated other than at school, and how we can present that data and information and what the trends are. Families can obviously give us feedback on, you know, how it's going and what their experience is of EOTAS, and outcomes for children and young people can be determined regarding the success, so we know whether it's actually good value for money and actually does it lead to a young person living their best life. And you know, the idea is sometimes you do have to do something differently because that young person cannot access a straightforward education. So really this is a pointer for the future. And those are the kind of things I think we probably need to be looking at, really developing that some new approaches and sharing those with you. I'll stop there. Thank you.
Thank you, Pauline. Thank you, Pauline. That was really, really helpful. Do we have any questions? No, we don't have any questions. Okay, so moving on to recommendations then. So recommendation 2.1 and 2.2, to make any further comment recommendation following discussions on the presentation received. I would like to put forward the following recommendations based on the report that you've seen tonight. That board resolves to recommend to Cabinet that Council co-produces an EOTAS offer for Derby with parent carers and children and young people to ensure we are meeting our statutory duties and produce an offer that Derby can be proud of.
Brilliant. Yeah, I accept the challenge. Thank you.
And I support the recommendation, Chair.
Thank you, Councillor Hazelgrave. Any objection? No objections. So we're all in agreement and put forward the following recommendations. Thank you. Thank you, Pauline.
Thank you very much.
Thank you.
Bye-bye.
Bye.
Cheerio.
Right, so moving now to item 9, work programme and topic review. In relation to our topic review, many of you were, well, you was all invited to the working group that we've been having. We are making good progress. We are currently consulting with children and young people, and we will be having meetings continuing. So we hope to bring a report to the first meeting of the next municipal year. So, right, if we're all happy with that. Yeah, okay, thank you everybody. I've had a fantastic year chairing Children and Young People's Overview and Scrutiny Committee, and I hope I see you all soon. So